Could you just tell us the precautions that you need to take to safeguard this kidney? And also, how does one prolong the life of this transplanted organ?
So, first and foremost, once you decide that you are going for a transplant, your nephrologist will sit with you and tell what is your basic disease. And when you go for a transplant, what is likely to be the post transplant scenario. The reason I'm mentioning this is you are a diabetic. If you get a transplant, your sugars are not under control. 100% of the times, your new kidney is also going to get affected with diabetic kidney disease. Okay. You have cystic disease in the kidney. What I mentioned, 10% of CKD in this country has cystic disease in the kidney. It will never come back in the transplanted kidney. So, knowledge of the underlying kidney disease, which has led you to reach dialysis stage, is important. And this I'm trying to emphasize because many patients, when they come to us, they will tell us that they had kidney disease, but they don't know why. It's because we have never done a biopsy of the kidney and made a diagnosis. Biopsy of the kidney early is necessary to make a diagnosis and treat it. It is also equally necessary when you reach a end stage to know what happens after transplantation. When I tell somebody to have a biopsy, they are afraid of the biopsy, they go away, they come back to me after 5 years. There's nothing that I can offer them because I have not been able to do a biopsy before. So, coming back to the question of precautions to be taken, when I'm going for a transplant, the doctor will tell you there are 5 or 6 options to go for a transplant. One, I can take a kidney from my sibling, my brother or sister. The best outcomes in the world are when your kidney is given by a sibling. The next best comes from parents, grandparents. So, taking from a sibling or a parent or a grandparent or a child is now by Indian law first degree relationship. That means if my patient needs a kidney from any one of these people, I don't need to go to the government and take permission for the transplant. Whereas the next best option after these, my parents, brothers, and sisters, they also may have genetically match with me, or their children, that is my first cousin or second cousin, they become second degree relationship. And even if I have to take kidney from them, I have to apply to the government. The state government has a authority called as the appropriate authority, like the director of medical education, who will go through the records and say you can go ahead with transplant from your second degree relative. So this will become third or fourth preference after sibling, parent, grandparent, or children. If even there in the extended family it is not possible, my spouse can give me a kidney, but the outcomes are not as good as my sibling. Across the world, there is enough experience with spousal transplants, and we know spousal transplants outcomes are better than getting an unrelated transplant. So the next option would be unrelated transplant, which by law is prohibited in our country. The last option is a cadaver transplant. By outcomes, it is not as good as a sibling transplant, but as you have just heard, 15% of our transplants are cadaver, and these patients also do extremely well. So in a typical kidney unit, if 100 transplants are done, less than 10% come from cadaver. And that is because of the donation in our country not happening. To simply share a statistics, in any neurological ICU, every day, probably at least once in a week, there is a brain death, but hardly any brain organ donations. So this will probably change when our awareness for the kidney disease and the donation and all that changes. So I hope I have answered that these are the things that you look for when you are going for transplantation. Once you have had the transplant, simple, you please make sure you are seeing your doctor at least monthly once for the rest of your life. Never touch a new medication without your doctor telling, and never miss a single dose, not single day, single dose of any of your medications, because the minute the blood levels fall, you will have a rejection setting. So always take medications without missing. Don't take any new medications. Keep a regular touch with your doctor. Even for the smallest of complaints, do not neglect, go back to your